Dr. Robert Strang, Chief Medical Officer of Nova Scotia. We talked a lot about you and followed you very closely during the COVID situation. And now we see something rising, raising rather, its ugly head in the United States, in Western Canada, Ontario, and has just recently been introduced into Nova Scotia, and that's the return of measles. And having said that, of course, uh, measles was thought to be eradicated, but it's back. Should we be concerned in any way, shape, or form like we were with COVID?
Not to the same extent around COVID, but it's certainly something that we need to take seriously. And I think the key message, and we can talk more about it for Nova Scotians, is make sure you're up to date with your measles vaccine. That's the best line and by far the strongest line of defense against this. But it is returning, and we're likely in Canada, if things continue as they are for the rest of 2025, we're likely going to lose our World Health Organization status, which right now says measles has been eradicated in Canada. But because of this resurgence, we're likely going to lose that. So that's a troubling signal. It indicates we've got issues around levels of vaccination uptake, but also measles we can't take too lightly. It can create very severe and significant disease. So it's not to the same level as COVID, but it is something we shouldn't be complacent about either.
But it's interesting you say that it's a simple matter of getting vaccinated against measles, and we did that decades ago and wiped the problem out. The problem today isn't so much about the vaccines not effective, it's that people mistrust vaccines because of, well, misinformation that's been provided over the last few years.
Yeah, I would say misinformation, but there's also been now in the last decade or more very deliberate disinformation, very deliberate campaigns, and I distinguish those because some people can be just it's incorrect information, but there's also this very deliberate strategy to misinform people. And you're absolutely right. The core around this, how we prevent, is the vaccine, and we have lots of experience. It's a very effective and very safe vaccine. That what we need to do is make sure we have very high levels of vaccine coverage because the virus, measles virus itself, is very infectious. So you need high coverage rate to prevent spread. But if we have really good measles vaccine coverage rates in Nova Scotia, even though we've had one case with no secondary cases, even though we're likely going to see more of these cases coming in from somewhere else, they won't spread widely if we have high rates of vaccine coverage.
The problem with that is, of course, you as an epidemiologist dealing with health issues and so on from a medical perspective, the problem here isn't measles. The problem here is the disinformation and the unwillingness of people to believe in the vaccine. And that's really not your job, is it?
Well, it is part of my, a part of my role as chief medical officer. I don't have all the solutions, but how do we continue to work to engage Nova Scotians with good information, create an environment that they feel that they can trust the information they're getting? A lot of this is really built on, and again, it's across North America and even globally, erosion in trust in governments, erosion in trust in science and public officials. So we need to make sure we're doing what we can do in Nova Scotia to build or rebuild that trust, direct people to evidence-based information and help them understand what's true and not true. The other piece of this is that we need to make sure that when people are looking for a vaccine, that it's readily available. So whether it's routine childhood immunization or now we have, we're offering updated vaccines for Nova Scotians, we need to make sure, and we have done significant advancements and investments in increasing access to vaccines. So that's not a barrier either.
In the meantime, of course, we have a very real crisis on our hands in Canada. Thankfully, not yet, and maybe not at all in Nova Scotia. But clearly, with the outbreaks in Western Canada and more specifically in southwestern Ontario, which continue to actually run wild, apparently, with dramatic increases. Are you concerned at all that this is the kind of thing that will just eventually get to our land too?
Well, I think we need to understand, and I was just on a call yesterday with my colleague, chief medical officer of health colleagues. Even though we're seeing lots of large numbers in Alberta, growing in Saskatchewan, Manitoba, large numbers in Ontario, the vast amount of the disease is in well-known parts of our community. So, for instance, in Southwest Ontario, Southern Alberta, where there are very specific community groups who really don't believe in vaccination for one reason or another. And so, and they tend to have large families, so lots of young kids unimmunized. So if something like measles gets introduced, you're going to have lots of people sick. And so that's creating lots of numbers. But what we're not seeing yet is, to any large extent, and something we're watching very closely, are we seeing what we call in public health general community spread? So the measles, even though the numbers are large, they're mostly in these very confined, well-described communities. That public health in those provinces at the local level is working very hard to work with those communities to increase vaccine uptake and control the virus. But once measles, highly infectious, gets into those communities, it is going to spread because there's almost no underlying immunity from vaccine. But again, is it a risk to the general population? Not so much at this time in Canada, and certainly not in Nova Scotia. But again, our best defense is to continue to build and make sure that Nova Scotians understand if and when they need a measles vaccine, and make sure it's available to them. And we're in the process of doing that.
Now, is there a situation where people who've had the vaccine in Nova Scotia and have never given second thought to measles, is there a situation where they need to get vaccinated again?
Yeah, so yeah, let me go. We talk about the population and kind of with measles, we need to talk about three kind of key groups. So it wasn't until the 1970s that we really started to have routinely available measles vaccine. So anybody born before 1970 is in Canada or even elsewhere where we didn't have vaccine, almost for sure was exposed to measles as a child. Even if they don't recollect having been ill, they were likely exposed and likely have long-term immunity from that illness. So for that group, so if you're born in 1970 if you're born before 1970, what we're saying is if you're going to travel outside of Canada, and this is because of increased risk of measles in other parts of the world, if you're in that group, even though you're likely immune, if you're going to travel outside of Canada, we say you should consider getting another dose of vaccine. The other end of it, so people born 1970 up until they're 1 year of age, Nova Scotians, they're all eligible and hopefully have received measles vaccine. However, if you were born from 1970 to 1995, you would have only been offered a single dose of measles vaccine. And if you haven't had a second dose, we're really encouraging you to come forward and get a second dose. And that's a lot of the people we've been immunizing over the last few weeks. People realizing, oh, I've only had one dose, and then I need to come for a second dose. If you're younger and were born in 1996 or beyond that, then you would have been offered 2 doses of vaccine. So you probably don't need another dose. We normally start immunizing with measles vaccine at 12 months of age and a second dose at 18 months. Because of the situation around the world, we're saying if you're parents and you have a child who's 6 to 11 months of age, and you're going to be traveling outside of Canada, we recommend, and this is a strong recommendation from public health for these infants because they're at the greater risk of severe disease, getting a single dose of measles vaccine early, and then you still have to get the 12-month and the 18-month dose. So at the born before 1970 or 6 to 11 months of age, the need to think about having a dose of vaccine if you're going to travel outside of the country. And especially the infants, we strongly recommend that. In between those age groups, if you're making sure you've had 2 doses of measles vaccine, if for some reason you can't find your vaccine record and you're not sure, then there's no risk at all about getting another dose or even 2 doses. A third or fourth dose in reality has no risk, and it's going to make sure that you have the 1 or 2 doses that you need to get fully vaccinated. And we have lots of access to vaccines. So your primary care provider, uh, of the family practice pharmacy clinics, calling your local public health office. We're using our mobile vans, which we developed that capacity during COVID. They're going around the province, public health, and offering vaccines, and we're including measles vaccine in that. So you can go to Nova Scotia Health, Public Health, and there's a look online about the mobile units. There's a whole schedule of those mobile units. So there's lots of access to that, to measles containing vaccine right now.
Now, when
I
we
know that
opened,
was
you
a
said,
long-winded answer, but that's really important information for Nova Scotians to understand. Am I in one of those groups, and what do I need to think about getting up to date with vaccine? And we've probably several thousand Nova Scotians in the last few weeks have come forward and gotten immunized. So it is having an impact.
indeed, and you opened by saying that Nova Scotia had a pretty solid regime of vaccination over the decades, and it was part of that the strength of our protection that already exists. I guess is why we've had only one case reported, where they're into the thousands now out west. Is that anything to do with the term I hear from time to time, herd immunity?
Sure. Yeah. Well, herd immunity means you have to have a certain level of vaccine coverage in the population to prevent kind of broad spread. For measles, you need to have at least 95% of the population up, fully vaccinated, because it's so infectious. We're probably not there. We're probably more, the data we have would say we're kind of in the 80 to 85%, which is good and does create a fairly good layer of protection, but it's not where it really ideally should be, to make sure that we're as protected as possible if measles gets introduced here, that it doesn't really have a chance to get a foothold and spread.
Now, I just want to end on the thought we talked about disinformation and a growing concern throughout the world, and certainly in North America, about the use of vaccines. Period, and more people have shied away. I mean, when we look at it and think we've been dealing with these for decades, and successfully, and proving beyond a shadow of a doubt that they work and they're effective all the way around the board without fear. How do you address that one more time?
Well, I think we have to keep making sure that we, as best we can, remain a trusted voice, that we're making sure that Nova Scotians have access to accurate information, and really reaching out to different parts of our communities to engage them in discussions around vaccine, and try to say, well, what are your concerns? How do we help you have accurate information? And along with that, we need to make sure we have really good access. Knowledge and information is one thing, but you need to allow people, when they're willing to act and get immunized, that they have very timely access to vaccination at the same time. And we're working on both of those. But it's not an easy world right now, in this world of disinformation, misinformation. And we continue to, we do what we need to do. And I think we need to do some work around, in our school system and others, how do we give people more critical thinking skills? And I would say to people right now, if you're looking at information on any social media, ask yourself a few questions. Where's it coming from? Does that make sense? Is there a credible source behind that? What is the vested interest on somebody putting forward that story? And I would really urge people to go to kind of credible sites for vaccine information, whether it's Canadian Pediatric Society, Nova Scotia, the government, our government site, the federal government, Public Health Agency of Canada, CDC in the United States. Those are all very credible sites to go to get the truth around vaccines.
And I really appreciate you saying, getting someone you can trust to tell you. And when it comes to this discussion with you, I'm very grateful. We could have had politicians talk to us, and I think there'd have been a grain of salt taken in the interview. You have proven, sir, especially through COVID, that your knowledge and your commitment is trustworthy. And I say that even in spite of the fact that you're a Montreal Canadiens fan.
Well, I'm not. I'm going to wear my Habs emblem on my proudly, and will continue to do so. But thank you.
Dr. Strang, thank you.